13 Cuban doctors. Among them are physicians and an epidemiologist. So far, 88 COVID-19 cases have been recorded in the province and 3 deaths. Well, for more on this story, we cross now to our reporter, Lutendo Bobodi, who's standing by for us in Polokwane. Thanks very much, Lutendo, for joining us. What's happening where you are?
Thank you so much. Out of the 217-strong medical brigade from Cuba, Limpopo has just received its share, about 13 medical specialists from that particular country. And they come right in the nick of time, because the cases here are surging up. They are skyrocketing, just in under 3 months. We have now, today, 93 cases. Basically, the prime contributing factor to this was, of course, the mining industry. People who were previously holed up in their provinces, they just came through during the recent 7-day window period. And then that's why today we see these cases. For now, I'm joined by Dr. Matuba, the MEC for Health in this particular province. Doctor, thank you so much for your time. We know that you have to write somewhere else. You were quite upbeat about these medical professionals who came today here, and you were also quite candid and honest. You were not running any illusion about the challenges, the healthcare challenges in this province. Just talk to us about the role they are going to play in this province.
I think we really appreciate the intervention by the President for us to find ourselves with these 13 battalions that are going to assist us. And indeed, as a province, we want to welcome them because they are coming at a very right time. This is a time, as if you remember, we have just completed our phase 1 of household testing and screening, where we screened more than 3.4 million and tested more than 4,000. We didn't have any challenges. Now we are on another phase, a phase 2, which I spoke about, where we are focusing on the targeted screening and testing and looking at our hotspot area. As you have correctly put it, our mining industry, it is currently our headache. It is our hotspot. It's the area where we need to zoom in. Now, their presence here, we need their expertise. Together with our current response team, we must zoom in the mine. We must go mopping up. We must go on a massive screening there, massive testing, but you can't just screen and test. You must also provide space for quarantine. You must provide space for isolation. And don't just isolate those who are positive. Close contacts, even if they test negative, we want to use the system that we're using throughout, which kept our numbers low. If we do that and we get full cooperations of all the mines, we will be able to win this. But if we still would want to argue, if people are still arguing with us to say this isolation that you are saying we must provide, it will not work and all that, we are not going to win. All of us are going to be losers in this, and losing in this battle means death. So we don't want to see ourselves in that situation. So let's work together. It has happened. People are infected. They are here. We need to now intensify our tracing, our screening, our quarantine, our testing, our isolation.
Okay. You also spoke about the mine joining you, helping you, fighting this. Do you get a sense that they are willing to help?
They have no option. They have no choice. They will have to come on board. We are meeting with all of them through the team that has been established by the Premier. This is not an issue of we want to choose. We know we don't have authority over what to say, but the reality of the matter is if we are in this together, we just have to do the right thing. And the right thing, it's what clinicians will tell you, it's evidence-based. Evidence-based means quarantine, isolate, screen, test. Then you will win this. What is the point for the mines to come and demonstrate us their beautiful testing machines and all that when they don't want to isolate? There's no need. You are testing for statistics. But if you are testing so that you can know who is infected and isolate while monitoring them, but making sure that the close contacts, you quarantine, you test them, you continue to do that, then you cap the spread. We just want to stop the spread because for us as a province, our main concern is that it's going to infect the vulnerable. And if you look the areas which these mines are operating, you have been to that area, you have seen the poverty poverty that is within that area. You have seen what is going on. It's not like it's an area which next to them there is a mine that is really performing or that is really mining within their own area. We've seen those particular people. If they get infected, they're not going to survive. They will not survive this virus. So this is the pain that I'm feeling currently, to say I need to protect that, and all of us must work together. The mine, yes, we're not objecting, they must operate, but let's operate while protecting. Because lives of our people, you will never get another second chance. Once we lose a person, the person is gone.
Thank you so much. Thank you so much. Thank you so much, Nompo. We've spoken with some of the doctors. They're quite upbeat about coming here. They seem to me that they were relishing an opportunity to come and work here. Let's just hope that they will help ease the pressure that is already weighing down on the healthcare system in this province.
Well, how is the community feeling about the surge of infections in the mining community?
Yeah. Look, they're petrified. You know, they are scared. You know, they know that. For instance, Nombo, in Skukune, where these cases are surging up, you know, just a few weeks ago they were on 0. Now they are sitting on 32. They have the lion's share of all the cases in this province. So, you know, when you talk to people, especially over there, they're scared. They're now not willing to go out and, you know, buy food and do other important stuff, you know, because it's rising in the province. You know, we still have only 3 dead, but just a few weeks ago we were sitting on less than 20, and now it's now 93 as we can report to you today.
Yeah, we know that it's a very infectious disease indeed. Thank you so much, Lutendo, for your time. Free State Premier Sim